Well, I think it's a very good question about asking about what are realistic expectations for any patient with any surgery, and specifically with the neck. Um, I use lots of analogies when I talk with patients to help them understand the point I'm trying to get across. And so, what I often say when it comes to the face and with the neck, um, I sort of like the tailor, and you found a vintage dress that's 50, 60 years old, and you bring it to me because it doesn't fit, and I make it fit you, but it's still the same material. So when I make the neck skin fit better and the deeper structures fit better, it's still the same skin. It's still the same deeper structures that were there. I just kind of reposition. I renovate with the same material. I don't. There's not new skin, or there's not something that's different that way. So as a result of the surgery, it looks better because the shape is better. It fits better, but it's still the same skin. So when you redrape that skin, it looks like we've improved the skin. But if you were to biopsy that skin, it would look the same. Now, there are things like some forms of various laser treatments and things that are helpful to improve skin quality, stimulate collagen production, that sort of thing. These are things that the surgery don't do, but they may help the skin maintain a certain look longer term. So often when we do a neck lift, it looks like we've improved the skin, but we really haven't. We just made it, as I say, fit better. But it's a more of a wow factor than trying to improve the neck with some of these non-surgical things, because generally they may be helpful, but they're quite variable in their response. And if the neck's past a certain point, they're not going to do much of anything, and the patient's going to be disappointed. But with the surgery, you tend to see more of what the patient's looking for. But again, the patient has to be prepared to go through a procedure. So it's an important thing to discuss with these patients in terms of what their expectations are. And if they think they're going to get neck skin back that looked like they did when they were 20 or 30, it's not going to be that. But it'll be better. But I think it's important to point out what's going to remain, because they need to understand that. Because a lot of times patients say, yeah, but you told me that the base of the neck is still going to be a little crepey or this. But all these things are somewhat important, because they're not all bad. Because if you've got a patient who's 60, 65 years old, I always say you want to look great at your current age. But if we're trying to make you look 30, it doesn't work, because it'll look strange. And so having a crease or two that fits with one's age range in certain positions is actually somewhat desirable, because it makes it believable. And the key with any of these looks is that it looks great at your current age and you look normal. And if somebody you haven't met yet mistakes you for 8 or 10 years younger, well, that's great, that's fine, that's good. But we're not trying to make you look 70 trying to look 30, because it never works. It never works. It looks strange, and people are looking not because it's attractive, because it's odd. And that's not a good thing.